is pharmaphorum web editor Nicole Rowley, and I am on site in Chicago for ASCO 2025. And the Congress is ending tomorrow, but before then, I have with me right now Dr. Lore Gruenbaum, who is Chief Scientific Officer at the Leukemia and Lymphoma Society, also known as LLS. A pleasure to speak with you, Laura.
Wonderful to be here.
So, firstly, please describe the landscape of unmet need in blood cancers.
Well, it's changed a lot over the recent years, but there still is a significant unmet need. And I think we see it in particular in the space of myeloid malignancies, and I'm thinking here of high-risk MDS in particular, and also of many forms of AML. And among these areas, we have in particular diseases that have, for example, mutations in the TP53 gene, or complex karyotype where our standard of care really does not give very satisfactory results for patients. But overall, these are more challenging diseases to treat. Another area that I want to highlight are many T-cell malignancies. Some of them do have very good outcomes, and some of them are quite indolent, but there are also a range of T-cell malignancies that are quite aggressive and where we really, beyond chemotherapy, don't have very satisfactory therapies. And these are all areas that are, I think, a focus of active clinical development and also a focus for us at LLS.
Absolutely, and that's why we're at ASCO to discuss what's going on in that field. So on that note of discussion, were there any noteworthy abstracts this year in blood cancers presented here at the Congress?
Yes, there were. In fact, we had a late breaker here at ASCO this year for a disease that generally probably doesn't get that much attention. It's a type of proliferative neoplasm, myeloproliferative neoplasm called polycythemia vera, really characterized by overproduction of red blood cells, sometimes also accompanied by white blood cell and platelet overproduction, and a therapy for which we really haven't seen a novel first-in-class agent yet. And we saw here at the conference a report on results from a phase 3 study called Verify, introducing rusfertide, a novel agent, a first-in-class agent that really has the potential to significantly move the needle. That has already shown positive top-line data that's released even before ASCO, showing that it significantly reduces the need for phlebotomy, which is a common part of the standard of care therapy, and probably can play an important part, especially for patients that using standard of care to manage their hematocrit, which is critical for patients with this disease, don't really get adequate control with agents that are commonly used in addition to phlebotomy, such as cytoreductive agents, such as JAK inhibitors, such as interferon. So patients that still significantly need phlebotomies can derive a very significant benefit with this novel agent.
Brilliant. So focusing now on LLS itself, what can you tell us about the LLS Therapy Acceleration Program, otherwise known as TAP, which is funding emerging first-in-class therapies?
I think it's quite an innovative program. It was actually started in 2007, has morphed a few times. And so the way we position it right now is a program that conducts equity investments in biotech companies, but very importantly, these are mission-driven investments really focused on novel first-in-class, potential first-in-class agents that we think can really benefit from also a collaboration with the team at LLS that is really laser focused on unmet medical needs, as we discussed earlier. And so in this program, there's an investment that's really paired with this partnership, with this collaboration, where we closely interact with companies, help them shape the preclinical and clinical development path, help them really connect with our vast network of both basic researchers as well as clinical investigators. And really the overall goal is to help accelerate and ensure that we can help develop an agent so that it really reaches those patients that are most likely to benefit.
No, exactly. So last question, and I have a sense of perhaps where you might go with it. What has been the key highlight for you at the Congress this year and you perceive might very well change oncology in the future?
Well, there have been many things, but maybe I'll take this opportunity to highlight data from two of the programs that are part of the therapy acceleration program that are in this area of high unmet medical need of high-risk MDS and AML. There were actually two oral presentations by company partners on two of these novel first-in-class agents. Both are new immunotherapies, one of them for high-risk MDS in particular, showing very promising therapeutic responses and durability of response in HMA refractory and relapsed high-risk MDS, again, where we don't have good options. The other one being an interesting new way to engage gamma delta T cells in for patients newly diagnosed with AML in combination with aza-venetoclax, azacitidine, the venetoclax, which is currently for patients that are not fit for intensive chemo, desired, generally the standard of care regimen. So both of those really promising, early data, really encouraging that I want to highlight. There is much, much more, of course, which I'd be happy to talk about.
And perhaps we might at a later date. Thank you for your time right now, though, Laura. It's been a pleasure.
Same here. Thank you.